Everyone. Thank you for joining and welcome to our first global webinar for World Cancer Day. My name is Amy Rosenblum. I'm with the Tired of Cancer team, and I'll be your moderator for today's webinar about understanding cancer-related fatigue. Before we get started, I just wanted to go over a few housekeeping notes. First, everyone is on mute to ensure call clarity. If you have a question or comment, please use the text box on the right side of your screen throughout the presentation. All questions are private and cannot be seen by the audience. We will answer all questions at the end of the program. Lastly, today's webinar is being recorded. This recording will be shared on our website at untire.me and on social media after the call. Today's webinar is scheduled for 45 minutes. We will take the first 30 minutes to meet our guests, talk about the problem, cancer-related fatigue, discuss the possible interventions and solutions, and then we'll use the remaining 15 minutes to answer questions from the audience. With that, let's meet our guests today. I am very excited to introduce Tired of Cancer's co-founder, Dr. Bram Kuiper. Dr. Kuiper is a clinical psychologist who has spent over 30 years in the field of psycho-oncology. Prior to starting Tired of Cancer, Bram was the head of the Helen Dowling Institute here in the Netherlands, renowned for its focus and work on cancer fatigue research and treatment. Next, we have Jelle Damhuis. Jelle is a two-time cancer survivor who recently completed treatment last year for non-Hodgkin's lymphoma. We're grateful to have him on the Tired of Cancer team as he is reintegrating back into the workplace. Today, he is working with us to improve our patient experience and working with patient advocacy groups to raise awareness about cancer-related fatigue, or CRF. Jelle, since your journey with cancer and cancer fatigue and working with us at Tired of Cancer, can you share a little bit about what you've learned?
Well, thank you, Amy. Yes, I will. After those few months that I'm using the Untire app and working here as well, I've learned that you're not alone, so that CRF is definitely a problem and that you can do something about it. So there are ways to cope with it. And I also learned that you have to take small steps. Before I always wanted to take big steps, but it's better to take small steps because every little bit can help. Yeah.
That's great. So now let's get started talking about the problem that we're here to learn a bit more about, and that's cancer-related fatigue. And what many people may not know, that it's the number one side effect of cancer and its treatments. Bram, if CRF is such a common side effect, why aren't we able to hear more about it?
Yeah, good question, Amy. We've discussed this with patients and also with healthcare professionals. And I think the most important thing and the main answer is that a lot of professionals feel empty-handed. They know it's an unmet need. They know it's a big problem, and but they don't know anything or less about possible solutions. And we know, and we will talk about it later on in this webinar, that there can be many causes, and there's not one solution for that.
Got it. So let's, I think, take a step back and really better understand what cancer-related fatigue is. Bram, can you share really what the definition is clinically?
Yeah, I like to use, and we use always the definition formulated by the National Comprehensive Cancer Network, a very prestigious network in the United States of America. And I can read it. It's a distressing, persistent, subjective sense of tiredness. So it's not, you can't measure it objectively. It's a subjective feeling. Tiredness or exhaustion related to cancer treatment that is not proportional to recent activity and interferes with usual functioning. So that's in a nutshell the definition.
So to your point, because there isn't just one test that can test for it, and it is subjective, that's one of the reasons we're not hearing a lot about it either. Yeah. Okay.
So there is no blood test or scan or something like that. So
Right.
you can measure the fatigue. And you can see in this slide there is a difference between normal fatigue and also the chronic fatigue syndrome in respect to the cancer-related fatigue. That in the last case it comes sudden, so it's you can't predict it, and it's without any warning. And it's not only normal fatigue or a little bit fatigue, but it's exhaustion. So you are really, you can kicked out of your life by this fatigue. And lastly, the recovery period, it lasts longer than with normal fatigue. If we have done something and we are fatigued by that, it can be something like sport, or you had a party and you slept well, then you can recover in a while. But that's not the case with cancer-related fatigue.
Right. So having an extra cup of coffee isn't really going to have much of an impact,
that would
right?
be the best medication, but no, it's not.
Right.
Yeah, you can see here the word cloud, and that's what we hear from a lot of patients. They all have their own way to describe the main characteristic of fatigue, and as you can see, it's debilitating, it's overwhelming, and it's feeling they feel drained by it.
Right. So everyone has their own way of describing it. Jelle, how would you describe the fatigue you've experienced, and how has that impacted your life?
Yeah, I do agree that it's different for everyone, but for me, it feels like it's like an attack of sudden exhaustion. So sometimes of the day, sometimes in the morning when I slept well, out of nowhere I get really exhausted feeling, and then I know, I have to recover and it takes a while. And that makes it hard to plan your day in advance, because you never know when it's going to happen.
Right.
So that's how I experience it.
So I know not being able to plan around your day, but there's huge implications that CRF can have, because everyone is different in terms of their lifestyle. Can you kind of describe some of the limitations that people face when dealing with it?
This is shown on this slide, and we know from clinical experience, but also from research, that it can be the fatigue can have a huge impact on daily life, and a detrimental effect on many aspects of the patient's quality of life. It has to do with physical limitations. You obviously can't climb the staircase. You can't take a shower. It's of course you can understand that it also have social impact. Not being the person that you want to be. Not being the mother or the father for your children or the friend. And last but not least, the emotional and psychological problems, a feeling of gloom, anxiety, sleep disorders, and problems with concentration and attention. And the physical, social, and emotional and psychological disabilities are often reinforcing each other.
Right. And I know, before you were working with us here at Tired of Cancer, you had your own online business, and it was something that you had to step away from because the fatigue was so challenging, right?
Yeah.
And so having to make full modifications around your lifestyle just to be able to work through the fatigue. Do you want to expand on that at all?
Yeah, well, because of the physical limitations, I had to stop my online business. And because of that, I became more social invalidation. Experienced more social invalidation. I could not work. I had a different role in my social environment, and because of that, sometimes I felt negative, or not as good as before. So
right, you couldn't
had a
stay.
big impact on my life.
Right,
all of those CRF factors.
Right. So changing your lifestyle completely, and I think what many people don't realize, and I know you had shared, you didn't realize that. There's so many other people out there who are experiencing this exact same thing, and the prevalence here, seeing that what's typically around 30 to 40% of cancer patients and survivors experience cancer-related fatigue. That's a lot of people. And I know we're just looking specifically at Europe and the USA, but that's 16 million people that we can roughly calculate. And I know we have this wonderful graphic here. So stretching all the way from Amsterdam to Beijing and back, that's a lot of fatigued cancer patients and survivors. I think the most important takeaway here, though, is that you're not alone. And I know a lot of people feel that it is a very isolating experience.
Yeah. Shall I explain something? Because the key question is what causes CRF and where does it come from? And we know there can be a lot of different causes, and that's also the reason that we always say it's multifactorial. We know that around 80 to 90% of all cancer patients during the first year after the diagnosis and during the medical treatments, they feel fatigued. And for the prolonged period, it's for 30 to 40%, what you mentioned, Amy. And we know that there can be all kinds of different causes. It can be tumor related, it can be treatment related, it can be related to comorbid conditions and all kinds of side effects of other medications that have been used by the patients. And of course, by diagnosing cancer-related fatigue, you have to take into consideration all these possible causes. You can see with the green arrows that there's a one-way relation between medical factors and cancer-related fatigue, but there is a two-way relation if you focus on the lower part of the slide about the psychological, the social, and the behavioral factors. Because we know that there is an interaction between those factors and cancer-related fatigue. For example, fatigue can lead to sleep disorder, and sleep disorder can strengthen and reinforce the cancer-related the fatigue. So there is a vicious circle going around.
Mm-hmm. Yeah, and that's a perfect segue. So, what exactly is the vicious circle?
Yeah, this is just an illustration of the vicious circle, and we know that many factors can play a role within that vicious circle, and I will emphasize that a vicious circle is a situation in which something has a certain consequence, while that consequence in turn maintains or strengthens the situation. And the people who are trapped or sitting in a vicious circle are trapped in a cycle of cause and effect, and always return to the situation they want to leave. That's the characteristic of a vicious circle. And for example, we have put some words into red because that are very often mentioned by fatigued cancer patients. Depression and stress and sleep disorder. And for example, limited physical activity. If you are tired, it's of course, it's understandable that you think, oh, I don't want to move because I'm too tired for that. And that means that someone can save himself or herself in one way only to pay the price in another way. That if you are not moving enough or not, you have too limited physical activity, you become more tired.
Right.
And that's what we call the vicious circle. And if you want to do something on CRF, you need to be aware of your own vicious circle.
Right. And so, Jelle, thinking about yourself and the fatigue you've experienced, when you see this vicious circle, what did you personally experience?
Well, for me personally, I experienced a lot of those symptoms. And I do agree that it's affecting each other. So, yeah, when I look back now, I was in the middle of this in the circle, but at the moment it was difficult to see that I was in it. But now it's easier to look back. It went on. So it was difficult for me to get out of the circle. For example, I had to stop my own business, no return to work, and because of that, I was feeling more depressed. I had stress, and because of that, I was sleeping not that well. So it all affects each other. So I do recognize all of that.
Right. Yeah, and I think to your point, Bram, it's important to take a step back and really evaluate yourself and what your own vicious circle looks like.
Yes.
So how do we solve for it?
That's
the big question that I know a lot of people want to hear more about. What are the treatments that they can do?
If you're looking for a solution, of course you need to be aware of all kinds of explanations. And we were looking for very thorough guidelines, and they have been given by the NCCN, the Standards of Care, in 2017. And before they formulated the Standards of Care, they did an extensive literature review, and these are the outcomes of that research. And they have compared the pharmacological interventions with non-pharmacological. And in red are the main conclusions, and you can see that regarding the pharmacological interventions, there is limited or no evidence for any effectiveness on the fatigue. And I have to emphasize this has to do with people where you couldn't find a provable medical cause. Right. Otherwise, it has to be treated in another way. But it has to do with the people where there's not any medical cause.
Right. So if you had anemia as a physical cause, you would need to have that addressed first. But for anyone who didn't have any physical issues, this is what you're talking about.
Yes, right. And you see at the right side, there are promising and very positive results if you regard the psychological and also the physical exercise programs, and that they are very promising, and that gave us a base for developing our own tool, our own solution against the CRF.
Right, and I think the important point to note that those elements are all promising, but the combination of them is especially powerful, right? So I think a great summary to cover what you had just reviewed in terms of treatments. There is no magic pill. We wish there was. We'd probably hear a lot more about it, but it's a complex problem. There's multiple factors that leads to cancer-related fatigue, and because there's multiple factors, that requires a multimodal approach, and that really leads us to the Untire app. So, Ram, I know you've spent many years kind of working side by side with specialists and patients to develop this app because of the complex behavioral and psychological information that's out there. So I guess what you created really is taking into consideration the standards of care from the NCCN and the best practices in clinical practice. And you've created a very comprehensive program that really anyone can use. And I think most importantly, it's free for anyone to download and use today too.
Yeah, and I'd like to repeat what you said, that we've developed this this tool, this program with a lot of people, and with patients and with professionals and researchers. So we got the idea, and we initiated this journey that we developed this app with a bunch of people.
So I think it's important to talk more about the foundation of what the app is centered on, and that's the 3 basic principles.
Yeah.
So first you have breaking through the vicious circle.
Yeah. We talked later about the daily program, but these are the principles that are, how do you say, the backbone of the app. And the first is first you have to monitor and to analyze and diagnose your own vicious circle, and the app will help you and guide you through those factors, and so you can focus on it. And of course, that's one thing. At a certain moment that you can see your own vicious circle, we are gonna help you to break through it, to break out of it. And you can do that on every level. It doesn't matter what kind of factor you like to take off out of the vicious circle. It can be your sleeping problem. It can be stress. It can be problems returning to work. Always try to do it with like Jelle said, small steps. You can't change or break through immediately from one day to the other day, because it took a long time to establish the vicious circle. So it takes a certain time also to break through. But that's the first principle.
Right. So recognizing the vicious circle and then figuring out how to break through.
I think maybe Jelle can. Yeah, I agree with what you said. For me, when I found out about the Untire app, and it made me aware of that I was in the vicious circle, and because of that, I could do something about it. So because of that, with like Prom said, with small steps, I went on to find a job, and that's how I ended up here at Untire. But it helped me to get moving again and to break out of the vicious circle with all the tools you get from the Untire app.
Right. So really just recognizing what those issues or problems are and starting to work on it, whether it is trying to focus on sleeping better or managing stress or kind of readjusting your expectations. All of those little pieces can help eventually help you break out.
Yeah, more self-confidence.
Yeah.
The second principle, we call it the phase of energy. It's a kind of metaphor to understand your own energy system, and imagine your system is a phase of energy, and the water level is the level of energy you have, and it comes up, it can rise, and it can
fall.
It can fall. So we know from cancer patients, but also from non-cancer patients, it refers to us all, that our energy level differs during the day. So in the morning can be different from the evening. So it's also a general principle, but to understand your own fatigue, you can use this. That means that think about things that gives you energy. And we know that you can get energy from walking or watching a movie or going to the sauna or having a good chat with your friends. There are things and there are circumstances that costs energy. And that's complaining people. That's what we often hear from people who are fatigued. Complaining people, they track your energy.
Yeah,
Negative. So if you think about this phase of energy, then you can conclude, if you pour enough energy in it, then the level will raise. But that's not true, because in your phase there is a leak. And that means that you drain energy. And it's like mopping up with the tap still on. If you are not focused on the leak in your system, and that most of the times that are unconscious sorrow. You have problems, financial problems. You have fear of recurrence of fatigue. You have stress and sleeping problems. All those things are not the monetary energy cost. costs energy, but that is continuously going on. And that's what we learn users of the Untire app to focus first of all on your leak. And the third principle, we call it the TAPCON model. It's from the cognitive behavioral therapy, and it's a model that gives you insight in your thoughts, and because there is a cycle going around. It's not the circumstances that makes you think that makes you behave in a certain way, but it are the thoughts about the circumstances that make you behave in a certain way and it makes you feel. And we know that a lot of fatigue cancer patients have non-helpful thoughts, and you have to change those thoughts in a more positive way.
Yeah, I think that really reinforces just how powerful our thoughts and feelings are in terms of how it impacts our behaviors and ultimately energy levels. So really, really interesting information there. So can you walk us through what the Untire program consists of and how it really helps patients gain energy?
Yeah, sure. I'd like to do that. But I advise and recommend everybody to download the app, to go through it and play with the app. It's very easy to use, and it gives you insight in all those elements. But let's go quickly through it. This is what you get daily offered. And for example, the right side of physical activity, it's about managing your energy, but it's also getting more strength and also getting more condition. So it gives you real concrete advices how to do that. In my themes, that are a lot of topics that can be attached to your leak. For example, anxiety, worries, sleeping problem, but also nutrition. And the left side, my exercises, that has to do with relaxation, to get some more grip on stress, stress reduction exercises, breathing exercises, for example. And to the left, the upper left, it's the tip of the day. And every time it's a kind of present you get every day, a nice tip to improve your mood. And to the right side, you can see that we have weekly measurements. We measure the level of fatigue and the burden you have from the fatigue and satisfaction, happiness. So you also can monitor your progress during the period. And we advise also people to use buddies during the period you use the app, because it can be hard to do it on yourself. It's a self-management program, especially if you are fatigued. It's hard to have discipline to continue. So you ask your partner, your kids, friends, the neighbors, whoever, to help you, to support you, moral and also social and practical.
Right. And we also have the Facebook community, right? I know we had talked about how CRF is very common, but people feel very isolated by it. And the community is especially important, that anyone can come in and share their experiences and share tips on how they're managing through it as well, so that they're surrounded by people just like them. And I know one of the comments continues to pop up as far as people not really understanding what it's like. So there is a way outside of the app in the community to get additional support.
Yeah.
Gela, how would you describe how the app has helped you personally?
Well, what I liked the most about the app is that, well, every day is different. So some days I just wanted to take a look at the tip of the day, or sometimes I just want to do a relaxing exercise. So it almost feels like a toolbox you carry with you, and you can always take a look at it and do whatever you want at that moment. For me, it helped me a lot to get more aware of my energy and what goes out, what goes in, and my leak as well, like Bron mentioned before. So the app really helped me with that, to be aware of it, and because of that, I improved a lot.
Right.
And I'm not there yet, but
step by step.
Step by step, yeah.
So really recognizing those, behaviors and the leaks, and then
Mhm.
taking action on them. It's
Yeah.
really what the program's about. Oh, that's great. So just to summarize, because I know we are right at the 30-minute mark and we'll have questions next, but most importantly, number one takeaway here is that you're not alone. Cancer-related fatigue is a very common side effect of cancer, and that so many individuals out there, patients and survivors, are combating and managing through it. Number two, there are ways to cope. There are treatments and solutions available that you don't have to give up and think this is just something you have to slog through. And lastly, Anila, you said this and it makes so much sense, but just small steps. You're not going to, be able to run up a flight of stairs immediately, but little by little you can work through, and every little bit really can help. So with that, let's open it up for questions. I think we had a few questions come in prior to our session. So I think the first one here, what advice do you have for those who think they may have cancer-related fatigue? And I'll look at Bram.
Yeah, I think we have, I will repeat it. Start talking about this with your doctor, your medical doctor, with your nurse, your general practitioner, because it's a very serious problem. And first, you have to exclude medical causes, and if there is any demonstrable medical cause, you have to treat that in a medical way. If it's not, there are options to improve your energy. And probably you can't be any more the person before the diagnosis, but you can be better off if you try to improve your mental and your physical condition.
Yeah, and we just had a question pop up that it's actually related, but we have the question, can cancer-related fatigue cause vision issues?
It can be. We know in general from fatigue that it can influence your vision. But if it's continuously, then I would recommend somebody to go to the doctor, and you have to check that.
Yeah. So just
because
like
not everything has to can be solved by walking therapy.
Right. So really having that conversation with your nurse or GP first, and making sure there isn't a physical issue.
Yeah. But we know that people who've burned out, they can have problems with the eyes too.
Okay, good. Next we have question number 2. What tips can you share for those trying to reintegrate back into the workplace? I know this is a common topic, especially after treatment. Individuals kind of want to restart their life. Gellert, can you share how you've been able to reintegrate back into the workplace and what tips you would share with others?
Yeah, sure. I think it's really important, like Bram mentioned before, question 1, let's keep talking about it, keep communicating about it. Tell your colleagues what you're experiencing, how your energy level is at that moment. Then they also understand when you're tired or when you're not feeling that well. They know, oh, it's because of this or because of that. And if you don't tell them, they won't know, and they will not how do you say it, recognize or accept it. So I think that's the most important. Yeah, the most important thing to do.
Right. So just because you're back at work doesn't mean you're 100%.
No.
And I can. It's hard for those involved because it's invisible. Like Jelle, he's a good-looking young man, 28 years old, but we know he likes to rest sometimes on our couch. That's right, not on the couch, but on the couch. So keep on talking and keep on explaining and try to find somebody, one of your colleagues or your employer, to support you in this journey.
Yep, very important. And on that topic, our third question: how can you help those around you better understand? Granted, they can't exactly walk in your shoes, but are there ways that they can better understand what it's like, what you're dealing with CRF?
Yeah, what you can do is we will put more information on our site for those surrounding and surrounding people with CRF. Try to read literature about it and testimonials and speak with your friend or your beloved one who is suffering from CRF to understand what's happening and believe it, because as I told, is that you can't measure it objectively. If somebody says I'm very tired, accept that that's real life, and that's people don't have to prove it, and that's often they feel guilty by the fact that they are tired because they think, oh, I can't do what they expect from me.
Right. Yeah, and I think the underlying theme here is talking about it and really communicating. And I think especially with those around you, really establishing with that network the need for their help too.
Sure.
I know a lot of people try to just take on everything and try to act like everything's normal, but that's certainly not really the case in many ways. We have a few more questions here. I want to make sure we get to. So does CRF get worse the more treatment you have? It says, I've been diagnosed a second time and worry it will be worse this time around as I am still suffering with effects from my last diagnosis.
Yeah. There have been, we did a lot of research on that, and there is a kind of effect that you can build up because of the medical treatments, the fatigue, but it's not always that linear. So think about all those causes and factors that are part of the vicious circle. We know that chemotherapy is very toxic and can make you tired. But if you stop at a certain moment with those treatments, then after a certain period, you need to recover from that. And if you don't recover from that, then probably there are other factors playing a role.
And we have another one here. Tips for older people who no longer work.
Yeah, it's a good question, and I can recommend the app because we do have some tips, especially for elderly people. It's in the part about the physical activity and about how to manage your energy. But most of the time, it's not very different from young people. Only the circumstances are different. What I said is we try to get yourself mentally and physically to move. Even if you think I can't walk, just start with 100 meters the first day and then 103 meters the next day, and so on, to build it up and be patient with yourself. I know that if you're elderly people have less social contacts in general, so that's hard. So look for buddies in that case. If you have nobody around you, try to find somebody to do things, to do shoppings, to help you.
Right. I know we had someone shared that they really didn't talk to their neighbors very much, but was able to talk to a neighbor that they never met before, and they started becoming walking buddies. And that really was a large part of staying active. And I think to your point, everyone's different in terms of the amount of activity they can take on. So it's really just starting somewhere and building from there. Okay. I think, do we have any additional questions? No. So we have a few minutes left, but as we wrap up, we just want to say thank you for your attention today. If you have additional questions or comments, please feel free to reach out to us directly. We have our email up on the screen. Since this was our first webinar, we certainly welcome your feedback, and if there are additional tips or suggestions for more topics, we look forward to doing more webinars in the future. And as I mentioned at the beginning of the webinar, this has been recorded, so we'll be sharing today's session online on our website as well as social media later on today. So thank you all again, and thank you to our panel, Jelle
Thank you,
and
Amy,
Dr.
and
Kuiper.
to all the webinar
Listeners.
listeners. Yeah.
Great. Well, thank you, everyone.